request everybody to please keep themselves on mute. And in case you have a question, please put it in the chat box, or you could just raise your hand. Good evening, everybody. I welcome all of you to an interactive session on cord blood banking and stem cells with Dr. Abhijit Bopardikar, hosted by ReeLabs. We are very, very excited and happy to have so many of you on board, and really hope that you learn a lot from this session and ask all your questions and doubts that you had all along. We also have Dr. Padma Priya with us, who is into stem cell research as well. And both the doctors are looking forward to answering all your queries. Over to you, Dr. Abhijit.
Good evening, everybody. Thank you for the wonderful introduction. Before I start this session, thank you once again to my team. So Saloni Singh Bopardikar and Dr. Padma Priya, Mr. Arjun Singh, Mr. Dhruv Singh, Meena ma'am. Thank you so much for this session. The whole objective of this session, and as rightfully mentioned by Saloni at the very beginning, it's let's have some fun with stem cells. Let's try and simplify, or let's try and demystify the world of stem cells. So one disclaimer at the very beginning, we are looking to have a fun session. We do not want to get into too many technical details because I can't see too many doctors here. In case there are doctors, apologies in advance. Let's make it simple for everybody, because the biggest question that people come back with is that we don't know too much about stem cells. It's too technical. There's too much information. We don't know what to dispense, what to imbibe, what to throw away. So let's try and simplify the world of stem cells for the benefit of everybody. Next slide. This is just my introduction. I am basically an MD doctor by profession. I have multiple laboratories, blood banks in the city of Mumbai. I'm also one of the promoter director of stem cell of ReeLabs Private Limited, which is one of the leading stem cell enterprises in Asia. We have, of course, when anyone uses the word leading, we have to always justify, when we use such fancy terms. But as we move along, we will definitely justify and simplify the whole world of stem cells for everybody. Next slide. In a nutshell, the employees and the well-wishers of ReeLabs may already know all this. We established in 2009. We are the pioneers in the field of stem cells. Again, when I use the word pioneer, it's not a fancy word. There are reasons for it, which I will explain going forward. We are the only enterprise that offers stem cell banking from over 10 human sources. So what those human sources are, what's the importance of banking from these sources, we'll definitely come to it going forward. We offer therapies for over 80 disorders. Which are these disorders? That too will be discussed going forward. We have 10 US, EU, and UK patents. Now, the British call it patents, the Americans call it patents. So maybe for this seminar, let's all call it patents. 3 of them are granted. Now, what exactly are patents? Patents basically mean the intellectual property that you have. So any technology that is cutting edge, that can actually be used in application of disorders, for which you need to seek ownership. there's a process by which we apply to a patent office. They go through the records, they poke a lot of holes, which we need to plug over a period of time. We've been through this ritual over 10 to 12 years since we first launched these patents. And quite remarkably and coincidentally, during COVID or during that COVID pandemic, all three patents of ours, which were like very, very close to our heart, and depicted the application of stem cells in a lot of disorders, including COVID-19, uh, were approved, were granted during that period. So that was a big feather in our cap. As mentioned, just to reiterate, we are also doing clinical trials in 3 disorders. One of them is COVID-19. And this COVID-19 based clinical trial was a trial that was asked to be performed by our Honorable Health Ministry, simply because there is no treatment for COVID. I think all of us know, I mean, before we progress to stem cells and this discussion, let's just reminisce about what happened in COVID. We all lost somebody or the other in COVID. And just to make it very simple, most people in COVID die not because of the virus itself. Okay. For all practical purposes, COVID-19 is just a virus. It's a coronavirus, which can be treated ideally like any other virus, the viral diseases where, symptomatic treatment, managing the fever, managing the hydration, etc., should manage the patient's condition. But paradoxically, this COVID-19 also gave rise to something called cytokine storm. And since I've used the word demystifying at the very beginning, I'll also try and simplify what cytokine storm is and in what way our stem cells help them. Cytokine storm is basically when your own growth factors, so basically your own immune system, which is supposed to look after you, paradoxically starts unleashing its attack on your organs and cells and tissues. When that happens, there is cardiorespiratory attack, then leading to cardiorespiratory failure, and very often death. So stem cells, what they did is what we actually documented, and we have a publication coming up in the American Association, which is a very prestigious journal, an American Association of Stem Cells, is that stem cells could bring down the level of these cytokines or your growth factors to baseline levels. When they came down to baseline levels, it theoretically meant, and as after the trial, it also practically meant that the growth factors were in the range of what they should be to look after you, but not spiraling out of control to an extent that it can attack you. So that is how it was curative. We have finished the phase 1 and 2. We are now looking to launch stem cells as the only treatment or the only approved treatment against COVID-19. Besides that, we are also doing a lot of work on critical limb ischemia using stem cells. Critical limb ischemia, for the layman, for the layman is basically something like a diabetic foot or a gangrene of the foot, where what happens is because of lack of blood supply, the foot or any extremities, they start getting shriveled. There's gangrene, and in case the treatment is not initiated on time, it can cause amputation and also death. So this is a product using stem cells we are looking to initiate to salvage the limb and to save lives. So when I talked about something at the very beginning that, we are pioneers in the world of stem cells, and we are an authority in the world of stem cells. It is not because everybody talks about themselves, but your actions speak louder than words. The most important thing for any enterprise dealing or any healthcare industry is that you document the importance of your technologies by patents, which we have, a big tick there, and clinical trials, which are government approved, a big tick there. So when you can do that, that is when you basically stand out from competition, and that is where we are. That is why we can call ourselves, maybe the pioneers of stem cell banking and therapy. The last line, which is again extremely important, is that we are the only enterprise which has a license and we have the technology and permission to bank stem cells from placenta, amniotic sac, and amniotic fluid. Now, the title of this talk was cord blood banking, or the importance of cord blood banking. let me tell you, cord blood banking is a misnomer. Cord blood is never banked. The stem cells from cord blood is banked. So apart from the stem cells from cord blood, which most enterprises globally are into or are invested in heavily, ReeLabs, using their patents and clinical trials and their technological wherewithal, we went into the nitty-gritties of banking stem cells from other sources apart from cord blood, because cord blood has been done to death. We realized that banking stem cells from placenta is a way better option. Of course, as we move aside, I'm sure one of the questions which will come from the audience would be why placenta. But to simplify it, it's a very large organ. Now compare, I mean, I think we all know how big a placenta is. It's a good 1.5 to 2 kg organ. It's a massive bulky organ. So to be very, very candid, it's very easy to understand that the size of the organ is so huge that the number of cells that can actually be procured or can be harvested from this organ is also bound to be huge. So that's number one, which means the quantity issue is resolved. Which is a big issue with respect to cord blood banking, because a lot of times in haste, because of things at which times during which the baby is getting all the precedence and cord blood collection is not given as much importance as it should. And once it's clamped and cut off, there is no cord blood left. So in case the sample is inadequate, our chances are gone. But with placenta, which is typically delivered after the baby is delivered, you have a massive 1.5 to 2 kg organ with millions and millions of stem cells. So that's number one. So basically the quantum is sorted out. Now the quality. The quality of placental stem cells is to be very uncomplicated, the best quality of stem cells possible. It is way better than any other source put together. In fact, all other sources put together, simply because stem cells, they express some markers, they express some properties, because of which, you can say they give rise to new organs, cells, or tissues. Each stem cell has got its own unique property. The good thing or the greatness of placental stem cells is that it's got markers of all kinds of stem cells. So right from embryonic to fetal to adult to any kind, all kinds of stem cells to hematopoietic, which are there in cord blood. All these stem cells are there in placenta. So hence banking placenta would ideally also mean, banking all kinds of stem cells at one go. Hence, when we got this prestigious license to bank placenta, we realized that we are now providing an option for any client or for any patient to bank all kinds of stem cells which are present in this universe by just banking this one organ. Next slide. Okay, I'm sure there are plenty of seminars, webinars, books that talk about stem cells and what the actual definition of stem cells is. I believe the easiest and the most accepted form of accepted definition of stem cells is these are special cells, but which are also unspecialized, which are tiny, and which are very primitive. That's number one. So I'll again repeat, they are special cells, but which are unspecialized, tiny, and primitive, but can transform themselves potentially into any tissue, organ, or body. So which means, like the example that has been depicted here, so a stem cell, a basic cell, can give rise to any organ, cell, or tissue, which means in effect, it can give rise to an RBC, it can give rise to a nerve, it can give rise to a WBC, it can give rise to a liver, pancreas, heart, skeletal muscle, anything. And just to extrapolate on that thought, if it can give rise to any kind of cell, organ, or tissue in your body, it also effectively means that in case there's a damage or destruction to any cell, tissue, or organ of the body, stem cells, by the virtue of their property to transform themselves into these tissues, can also induce repair or regeneration of that organ, cell, or tissue. So that is where, stem cells are unique, because they can ideally have a big role to play in the development of organ. First of all, in the genesis of organ, the development of organ, the maintenance of the organ, and also in case of any damage, the repair of the organ. Next slide. As mentioned earlier, there are 80 disorders, but trust me, this number is limited uh, in this presentation, but its potential is unlimited. And I'll say something which possibly requires guts, but I think it's a good platform to say that in the next 5 years or thereabouts, stem cells will possibly have a role in each and every disorder that can be treated by conventional medicine. Let me reiterate, stem cell medicine is not alternative medicine. It is pure clinical medicine. It is something that most doctors didn't study about in their undergraduate or postgraduate curriculum. But it's something that has now been embraced by the medical fraternity. In fact, there are chapters on stem cells which are now coming in. I'm fortunate to be authoring 2 of those chapters. I'm already authored 2 of those chapters, which are there in postgraduate journals of medicine. And very clearly, the entire medical fraternity has realized, has embraced, has come to terms with it. So whether they're cynics of stem cells or lovers of stem cells, they have realized that stem cells is here to stay. And we all wake up and smell the coffee. This is the future. This is something that is going to have a big role to play in curing most disorders that are known to mankind. Next slide. Okay, what are the sources of stem cells? Just to reiterate, there are plenty of sources. Only 10 have been mentioned here, like cord tissue, cord blood, placenta, amniotic sac, amniotic fluid, dental pulp, menstrual fluid, adipose tissue, bone marrow, hair follicles. Now, each of these sources have their own distinctive quality. Each of the stem cells isolated and banked from any of these sources have their own distinctive quality and have their own application. ReeLabs is fortunate to have technologies to bank these precious cells from all these organs and more if required. So we've also done some work on gut stem cells, that's your small bowel stem cells. We've done some work on pancreatic cells. So basically, if there's a source of stem cells which is available, we are more than geared up to try and extract those cells and work with them. Next slide. I mentioned this about 5 minutes back, that the best sources of stem cells are available at childbirth. So whether it's your cord tissue, cord blood, amniotic sac, amniotic fluid, placenta. And a word that I'm going to keep using during this session. I know we need to have 45 minutes of fun entertainment, but also let's learn. Let's learn something new. Let's learn something important, something relevant in everybody's life. The thumb rule with stem cells is that younger the better. Okay, so that's the easiest thumb rule for anybody. So anybody who's listening to this presentation who has not heard even the word stem cells, just remember one thing: the best stem cells are the one which are young. So the youngest stem cells are the one which will always be better. The youngest stem cells at childbirth are from these 5 sources. And I've also mentioned that placenta encompasses the markers of stem cells from all sources. So typically, if you bank placenta, it ideally means that you've banked all kinds of stem cells. As you grow older, the adult stem cells come in. So whether it's your fat, whether it's dental pulp, whether it's adipose tissue, whether it's hair follicle, any of these sources, they all have their limitations, but they have their own individual applications. But which are the best form of stem cells? These 5 are the best because they're available at childbirth. Why childbirth? Because they're young, and the youngest are the best. Next slide. And if we have to further scrutinize out of those 5, which are the best out of those 5? So best out of the best, then I'll pick and choose these 3. That's the placenta, amniotic sac, amniotic fluid. Though basically the FDA license is given to cord blood, but cord blood only has hematopoietic stem cells or stem cells that give rise to your blood forming organs. These three sources together are called placenta and can give rise to your blood forming organs as well as tissue forming organs. So basically encompasses all kinds of stem cells. Hence, this is like the best form of stem cells. Next slide. I just mentioned that the best form of stem cells, again, why? Because in terms of quantity as well as quality. Now compare it with cord, the small pie chart, the diagram on the right. Cord tissue pie and cord blood hardly account for 10%. Well, 90% of cells are accounted by placenta. So it will basically be a biological disaster. I mean, in case if you have an opportunity of banking placenta and we've given it up. So it's an appeal, a heartfelt appeal that in case there's an option to bank placenta, kindly go ahead, because these cells, and again, when I'm saying something, I'm saying on basis of research, basis of publication, basis of facts and documentation, which thoroughly mention that the stem cells from placenta are the best form of stem cells. Next slide. Actions speak louder than words. It's very easy for me to say that these are the bank and keep going gung-ho about which cells are best, which cells are not best. But out of all the cells that we had, and we, as I mentioned, we have the wherewithal of banking stem cells from all these sources. We have conducted the clinical trial, which is approved by the Government of India, the Health Ministry, the FDA, the ICMR, and all the regulators, using a patented product from the placenta. And the results are for all to see, because the results are very good. All our patients got discharged. All patients are moderate and severe COVID. They all got discharged. They're all doing well. And the results were sent to the American Association of Stem Cells, who have accepted it. And they will now be publishing it in their journal. We'll be happy to share a publication once it's released. Next slide. Okay, now a fun fact. Okay, when we kept talking about simplifying, fine, this, I know it's been a little technical, but our job is to try and mix some fun and the technical nuances. Somehow stem cells have this uncanny habit of matching with grandparents. Now, whether it's because grandparents love their grandchildren more than parents, that's a matter of conjecture. I won't get into those controversies. They could have severe ethical repercussions. But that is a fun fact, which means now, on a serious note, in case the grandchildren's stem cells can match with their grandfathers or grandparents, to be precise, wouldn't it be a good idea to look to apply these stem cells after banking for the grandparents? Because grandparents, I mean, we all know we all age. With time, there is, degeneration. There are age-related, disorders kicking in. So all your Alzheimer's, dementia, eyesight issues, your, even cosmetic issues like wrinkles, your kidney failures, your lung problems, heart failure, all of them come in, and they all constitute something, a monster called aging. So in case these cells can be immediately used to regenerate a grandfather's or a grandmother's body or cell or tissue, we are looking at very, very huge applications. And there is a lot of work being done in this, more as we talk about it. So that's the fun fact. They match with grandparents more than parents, which is obviously a good thing. Thank God for that. Next slide. This is our facility. We are located at Goregaon. I think most people on this forum would have already visited our facility at some stage. It is spread over 50,000 square feet. It is on, at the edge of a hill, or to be precise, the edge of a valley. So there's a beautiful green zone. There's earthquake resistance. It's pristine. And it's very near the airport, so it helps in our logistics. So if in case we need to send stem cells or receive samples for processing, the location at Goregaon really works for us. Obviously, we have all the necessary licenses, accreditations, permissions from the prescribed regulators. It's a beautiful facility. In case you all have not come, do take an appointment and drop in. There's much to learn. Seeing is believing. Next slide. Yes, these are the three patents. I wish I could have enlarged them a bit, but uh, it also gives you a little sneak peek into what these applications are. As mentioned before, the most important thing with any biotech enterprise or any research enterprise is that there needs to be intellectual property that has some bearing in altering patient's health and vitality. Uh, just having intellectual property is of no relevance to anybody. It needs to be validated. One of the most pronounced form of validation is receiving a patent. So we received all these three patents again. To repeat, during the COVID phase. So in 2021, all these three patents came in. One of these patents is the technology we are using, placenta, where we are using to treat uh, COVID-19. The other patent is a technology where we're using fetal cells to treat diabetic foot. And also going forward, we'll be using that technology to treat lung fibrosis, also called smoker's lung, to treat diabetes, to treat osteoarthritis, and many other disorders. Next slide. Okay, so that was a little sneak peek into what we do, what stem cells are. I hope it's simplified the world of stem cells to an extent. Of course, this process will go on with more questions and answers. I'm open to questions. My team member, Dr. Padma Priya, is also geared up to take a few of your questions. Most welcome to shoot your questions.
Thank you, Dr. Abhijit. That was really nice. And now I invite you all to either you can put your questions in the chat box, or you could just raise your hand, whatever works for you, and we'll take them one by one. Thank you. Doctor, could you give us some insight about stem cells with respect to anti-aging? Like, what are we seeing in this field? Doctor, you're on mute.
Anti-aging is a very advanced technology, and stem cells, as I mentioned before, are one of the most important parameters to address this issue. Now, aging is not a disease. Aging is a condition. We all will age as we grow old. Nobody is immortal. However, as we age, what typically happens is a wear and tear of our tissues, organs, and cells. Stem cells, by the power of regeneration, can repair as well as revive old, decaying, and degenerated cells, organs, and tissues of your body. And on a genetic level, I think we may have heard of something called telomere. Just for the uninitiated, let me tell you what a telomere is. Telomere is basically the end of a gene. The end of the gene is called telomere. This is one of the most important part of a gene that is required when you are studying any of the aging processes. What happens with aging is the length of the telomere, because it's the end of the of any gene, it starts shortening. So anything that can delay the shortening of this telomere or the end of the gene, which depicts aging, can potentially also mean that it is reversing aging. So there are a lot of things that can be done, a lot of protocols that can be followed to delay the aging of this telomere, also giving telomeres as well as demethylation of genes. So again, I'm sorry, it's a little technical, but anything that can alter or can slow down the shortening of the telomere, whether it is physical, whether it's metabolic, or whether it's genetic, can slow down the aging process. Uh, and all these three can be very comprehensively targeted by the placental stem cells. That is why during the presentation, I also mentioned that paradoxically or ironically or, fortunately, the grandparents' stem cells match with their grandchildren. So obviously, grandparents are senior citizens for all practical purposes. Their aging gene would be very pronounced. The telomere length would be very short. So these cells can alter that. And once that happens, the biological aging, which is by basically the wear and tear of the tissue. See, nobody can change the passport age or the chronological age, but biological age can be reversed to an extent. And the best form of reversal is using the placental stem cells. Why? Because of its impact on the telomere gene.
Thank you, Doctor. Dr. Jivita has a question for you. She says that give us an insight of the risks associated with blood banking. I
Uh,
assume she means stem cell blood banking.
yes. See, thankfully, Jivita, there's not too much risk associated. Why is there no? I mean, I'm assuming your question basically pertains to risk associated with the mother at the time of collecting this precious cord blood, and oblique or to the baby during the same time. Correct me if I'm wrong. So what I understand is that you're worried about the health of the baby and the mother during the process of cord blood collection. So let me again simplify the process of childbirth here. We all know what childbirth is. Childbirth is when a baby is born and all the changes that happen in the genital organs to expel the baby out. That's the very easiest gynec definition of childbirth or delivery. To make it very simple, cord blood is collected only after the baby is detached from the mother. Okay. So what happens is once the baby is born, the cord is clamped and the baby is no longer associated with the placenta or the cord blood. That is when this is biological waste material that will ideally be discarded. That is when this material which would have ideally been discarded is the one that is collected. So anything that would have been discarded is obviously of no health significance or no adverse health significance to the mother or the baby. So it's a very safe procedure. And to top it all, FDA never gives a license to anything that they're not sure of. In fact, the kind of scrutiny that they go through to validate a process is exhaustive. So the very fact that there's an FDA license for this activity, it means that it's absolutely risk-free.
Thank you. Sai wants to know how long can placental stem cells be banked for?
I'll extrapolate this question to how long can stem cells be banked. There was a movie called The Spy Who Loved Me or something like that, Austin Powers. So I don't know if anybody has seen it, in which there was this person who was kept in liquid nitrogen tank for centuries. And after centuries, he was thawed and he became a live person, and then the rest of the movie continued. So in the same way, in the state of liquid nitrogen, stem cells go to sleep. It's also called the state of senescence. Senescence means sleep. So while we have packages for 20 years, 25 years, 30 years, 40 years, 75 years, potentially once these cells are frozen in liquid nitrogen, they go to sleep and they can be woken up after n number of years. Now, n number can be 20 years, 50 years, 100 years. So in fact, it can be banked till eternity for all practical purposes. Of course, there's no point of just banking it for the heck of it. That's why we're talking about application of stem cells. But it can be banked any form of stem cells from any source, whether it's a fetal source or an adult source, can be banked for n number of years. At this point in time, the maximum banking which is permitted or not permitted, which is offered to clients is, I think, 75 years.
We have another question, which is On taking the storage plan with your company in future, if your company dissolves, what is the process to get the stem cell? How can it be compensated?
Uh, See, I don't have any. I mean, I would not want to get into the financial health of the stem cell sample. But let's try and simplify this too. Now that it's the question has been posed. Firstly, the financial health of ReeLabs is quite good. So we are pretty healthy financially. I don't expect any issues with respect to your sample during your lifetime or your child's lifetime, or hopefully even after that. But just to make it very simple, again, let me extrapolate this to any bank, because you could have banked with some other stem cell enterprise. To make it simple, the stem cells are banked in these huge cryo containers. So these containers have racks and shelves in which, after processing, we store those vials. We have about 10 vials per client. Typically, in one huge vessel, there are about 2,000 clients sitting, rather samples of 2,000 clients sitting in. And all we need to do is, it doesn't run on electricity to be precise. So even if there's no electricity, doesn't matter, because it only sleeps in liquid nitrogen. So as long as the level of liquid nitrogen is maintained, there's no problem to your sample, there's no problem to your cell, there's no problem to your to the potency of the cells. In case something goes wrong, financially or otherwise, where that sample has to be moved, so the easiest way is just pick up the whole tank and just place it somewhere else and ensure that its backup mechanism continues. As far as I know, there have been some takeovers, some good and some hostile, especially in the US, without giving out names. So what they did was, after the takeover, those tanks belong to the new enterprise, and some of them changed their location, some of them didn't. But as long as those cells were kept in liquid nitrogen is a state and in a frozen state, there's no problem with the sample or its vitality.
Thank you. We have a question for Dr. Padma Priya. In a state of emergency, how long can the sample be preserved without an ice box?
Uh, Without an ice box.
That's for Dr. Padma Priya.
Yes.
Hi, good evening, everybody. Thanks for this wonderful webinar, and thanks for the wonderful organization. And it's like, what is your question again? Sorry.
Somebody wants to know that in case there is an emergency, how long can a sample go without any ice box or any other thing? How long can it be preserved without any ice box or any other thing?
The cells or the sample, the cord blood collected sample?
They have just mentioned how long can the sample be kept without an ice. I think they've not even mentioned that. It's just without ice box. How long can it be preserved in case of emergency?
It can't be preserved. It is
No.
like in an hour time, every hour the cell dies.
Right.
Let me try and simplify this for the person who just posed this query. See, necessity is the mother of all invention. Okay. Typically, when I mention that stem cells are stored in liquid nitrogen, it also means that they cannot be stored outside liquid nitrogen. So in case there's an issue with respect to the storage or any issues with storage conditions, there is a very high likelihood that the sample can get spoiled or unusable. The thumb rule out here is also very simple, that samples are stored in cryogenic conditions or in frozen state. They are also stored in vials by ReeLabs. First of all, you need to understand how many cells are required for that treatment. So let's have an illustration. Supposing we have about say 100 million cells of a client A. Okay, it doesn't mean that it has to be 100 million. It's just an illustration, and which are kept in vials of 10 million each, which means 10 vials of 10 million each. Now there is a condition for which the patient requires only 20 million. So the easiest way is to pull out 2 vials from the rack, thaw them, and then give it for transfusion. After you have thawed and given it for transfusion, it cannot be refrozen. Okay, because once it's thawed, it has to be used. typically after thawing, in any case, you lose about 4 to 5% of cells, which we always factor at the time of banking. So don't worry about that. But once they are thawed, they have to be used. So it's a good idea to thaw at the bedside of the patient. So in case of the patient who is admitted in the hospital and he needs 20 million cells for the condition for which we are treating, those vials have to be sent in a frozen state to his bedside. Get the doctor, just like fresh frozen plasma. Plasma also is thawed by the doctor at the bedside, and then an infusion is initiated and executed. Without that, it's not that the plasma can be refrozen. Same thing, once you thaw it, use it. If not, you have to discard it.
I have a question for Dr. Padma Priya. The question that was just asked, it meant that when a sample is collected after the baby is born, typically we are asked to place it in an ice box, and then it is transported to the lab from where the stem cells are harvested. Supposing in an emergency, we forget to carry the ice box to the hospital, or something happens where there is no ice box available, then how safe is it to transport? What will be the condition of the sample until such time it reaches the lab? Is it okay? What is the ambient temperature that is required to maintain the sanctity of the sample collected?
4-degree ambient temperature is required to have a good viable cells while isolations. So as if it's not transported in ambient temperature, the viability reduces. The isolation of when we isolate the cells, the viability of the cells reduces.
So does that mean that we can just keep it in an ice box, just keep it cool and maintain the temperature, and it'll still be okay?
No, there is a time limit also.
Yeah, talking about, I mean, considering the time limit and everything, if it is in Bombay, say I'm in Colaba, it has to come to Goregaon, and I cannot lay my hands on an ice box, but I keep the sample in the refrigerator, and then from there I take it out, and it will take me about, what, an hour to get it to Goregaon?
Yeah, that's fine. That's
right?
That's fine.
Okay.
That's fine.
Okay. Thank you.
Welcome.
The prescribed time limit which has been provided by FDA is 48 hours. In fact, 48 to 72 hours. So as long as it comes to the lab within 72 hours, it should be in a position to be banked.
Okay, we have another question, which is, can autism be treatable, and up to what percentage it can be? This is a question from Harminder.
Autism comes in the spectrum of regenerative medicine. So autism, Alzheimer's, dementia, cerebral palsy, muscular dystrophy, all of them come in this field of regenerative medicine. In fact, there's a lot of action and very hectic action taking place to treat these disorders using stem cells. The short answer is yes, it can be treated. The long answer is it's a good idea to first get the clinical trial done, go through the data, patient eligibility, patient selection. All these things need to be very, very meticulously checked. And only when all the boxes are ticked should the patient be taken in for treatment.
We have a question which came on WhatsApp, which is for the cure of diabetes. How far the stem cell is helpful, by Mr. Rakesh?
There have been, I think, if I'm not mistaken, the last I saw there are about 320 clinical trials going on. I think Priya will be the right person to concur. 320 clinical trials on diabetes globally, which are ongoing. And most of them are in phase 1, 2, and 3. What these trials essentially do is they're looking to transform these stem cells which are injected. Either they're injected directly into the pancreas or in the femoral artery, and then from there they reach the pancreas, or even a simple intravenous injection, to give rise to islet-like cells which can secrete insulin. And if that is done, it brings down the blood sugar. So islets can be generated in vitro as well as in vivo. Again, the short answer is yes, it can be treated. Long answer is there's a lot of work still to be done. And In fact, diabetes is one of the pet disorders for most stem cell researchers. And we believe we are very, very close to a revolutionary approach using stem cells to treat diabetes.
We have another question. How can amniotic fluid be preserved sometimes? Is a question asked by doctors and gynecologists.
How can amniotic fluid be preserved?
Preserved sometimes. Questions from maybe some doctors are not aware of how amniotic fluid can be preserved.
Yeah, it's a very, very important, very relevant question. The thing about amniotic fluid is amniotic fluid essentially means the fluid in which the baby is floating around and also drawing its nutrition, oxygen, and health. So it's basically the connection between the mother and the baby in the uterus apart from the umbilical cord. In a normal delivery, obviously, as we all we use the word called the water sac burst or the water breaks. Basically, it means that the sac in which the baby is sleeping around is something that just bursts and the water comes out, and then the baby is ready to come out. In any regular normal delivery, amniotic fluid cannot and should not be collected, simply because it has already organically the bag is already organically broken, and the sample would be contaminated. And if it's contaminated, it's not in its healthiest state to be used for banking. The only way by which amniotic fluid can be collected is by amniocentesis, which is at the time of delivery during cesarean section. Now, during cesarean section, what they do is they basically cut out the amniotic fluid, amniotic sac after incision of the 2 layers of the uterus. They reach the sac, it bulges out. That is when they cut it, let the amniotic fluid leak out, and that's when the baby is delivered. So before that is done, an injection is, the amniotic sac is injected using a needle syringe, and the amniotic fluid is sucked, which means it is clear, transparent, and uncontaminated. So these are very, very healthy stem cells and should be banked if possible. It cannot be collected if it is blood stained or meconium stained, because either of these conditions can destroy the viability and potency of the stem cells.
Somebody wants to know whether stem cells can be used to treat the Rett syndrome.
Rett syndrome also comes in the category of degenerative disorders. There are a few trials which are happening on Rett. In fact, I happened to get some information on that, and the results are quite positive. Whether it's an approved treatment yet, answer is no. Whether it can be treated at some stage, answer is yes.
Dr. Priya, would you like to contribute to this question?
For the Rett syndrome?
Yes.
Yeah, we have treated some of the combination of autism and the Rett syndrome, and we have achieved good results. So it is treatable.
Just to make it simple, basically any of these genetic disorders, whether it's Down syndrome, whether it's Rett syndrome, or any mutation like disorders, because of where the degeneration of the muscle or the skin or the tissue or the ligament is because of genetic abnormality, you cannot change the genetic makeup or the genetic deficiency. But what can be changed is the functional look. So in case there's a weakness of a muscle, by regeneration of muscle, because that is what stem cells do, that muscle which has been impacted by the genetic deficiency of a Rett syndrome can be treated. But can Rett syndrome at the genetic level be treated? Answer is no. And this also encompasses any other genetic problems which have physical manifestations, which the physical manifestations can be treated. The genetic makeup cannot be altered.
Yeah, Dr. Abhijit has rightly said about it. So genetics cannot be corrected with the stem cells.
Also, Dr. Padmapriya, could you just help us understand in a very simple language what is HLA matching that everybody talks about in stem cells?
HLA matching is a histocompatibility from, there are some, it's like first the grouping has to be done, for whatever the kid is born, and with the siblings or whoever want the blood to retrieve, the sample to retrieve, the first the blood group is being matched. This is the basic thing. And second thing would be, there is a matching, at least there is some percentage of the match. It has to be done with the blood taken from either from the grandparents or whoever want the sample, or the siblings or the mother or the father. So HLA matching is done, and it is mostly it is matched for the siblings and some of the members, family members, and to some extent it should be matched, and they can be used. The material can be used.
Thank you, doctor. We have another question. So Harminder wants videos and testimonials. Mr. Harminder, we'll leave our email ID out here. You could just send us your requirements on that, and we will let you know what all is possible from our end. Mr. Arjun has a question for us.
Yeah, hi doctor. Just wanted to ask about the stem cell treatments taken by Schumacher and Nadal. What kind of treatments were there? I mean, like, why did they take them, and how was the results? If you have any idea on that.
Yeah, that's a very relevant question, especially with the Wimbledon ongoing. And I believe Nadal is already in the semifinals, and he had a tough 5-setter. And people felt that he was going to retire after 2 sets, and he came back after injury timeout and managed to win. Now he's one of those guys who's a massive exponent of stem cells, and he's one of the massive exponents of the virtues of stem cells. Something that I've already mentioned at the very beginning: stem cells can regenerate potentially any tissue, cell, or organ. So generally in sports injuries, what happens? The ligaments or the cartilage are the ones which are very prone to wear and tear, and also injuries and tears. Stem cells, by virtue of their properties, can help the healing faster. So I know for a fact that many sports people, not only Nadal and Federer, and there'll be many others even in the cricketing world, who basically take these stem cell injections, maybe autologous, which means their own stem cells, to promote quicker healing, so that they can overcome the injury and get back to their field of expertise as soon as possible. So I know for a fact that Nadal got his ligament, his chronic ligament tear, especially of his foot, treated using stem cells. And as we know, rest is history. He managed to win 2 more Grand Slams on his way to winning another one, if all goes well.
Thank you.
We had a question for Dr. Padma Priya from Dhruv.
Hello.
I'm just seeing a question from Jivita to everyone. I'm asking about the risks with money aspects in terms of relation of parents, ReeLabs. Okay, Jivita, I'm sorry, I'll just come in here because I happen to just see your question. I am not somebody who will get into the price discussion, because that is not for me to get into right now. That's not my forte. But let's understand that the whole purpose of banking is to ensure that those cells, or those precious cells, can be used for treatment. And we are doing a lot of work to document the you can say the application of these precious cells in many disorders. Only then will I believe that the entire essence of banking is well covered, is justified. We are always on a lookout to do adequate trials, experiments, patents, publications that depict the usage or the application of stem cells. All that, if I'm not mistaken, does cost a lot of resource. But at the end of the day, it's like a biological insurance. You want to take an insurance, but when you take it, and in case, God forbid, anybody requires it, you should be in a position to optimize it to use it and benefit himself and his family. And that is what we are geared to do, and that is what we plan to do. Hope that answers your question.
Yeah, we have a question for Dr. Padmapriya.
Yeah, sorry. We have a question, Dr. Padmapriya. It says, how can we get the details, whether the condition of a stem cells and all other details like blood group of quality and quantity, etc. I think the question is, how do they know what condition the stem cells are in, or what quality means basically how good the stem cells were when they came to the lab, and what was the quality and quantity, that kind of.
So once the sample reaches the lab, it has been registered, the time of birth, the time it reaches the lab, and so once it's been isolated, before isolation, sterility control screening is done, sterility control is done, and it is given for isolation. So once isolation is done, so it is being controlled by the CD markers flow cytometry. There is a CD markers which says the number of viable cells, number of CD34 markers, CD45 markers, which says about the blood forming cells, and there is so all these parameters has been mentioned in the certificate which should be given to the patient.
Thank you.
Thank you.
We have another question. How much cord blood is required to treat any blood disorder? A question by Mr. Ajay Yadav. Dr. Abhijit, would you like to take this?
Now, this is a very, very vexing question, because more often than not, we are stuck with not having a very clear answer on this. But to make it very easy, the most important thing is getting a good harvest of CD34 or hematopoietic stem cells from the cord blood. Hence, as per FDA requirement, the minimum quantity of sample that needs to be collected at the time of childbirth is about 50 ml at least. So if 50 ml can be collected, the most precious hematopoietic stem cells, which are the CD34 marked stem cells, should be above 1 million, and that should be adequate to facilitate a successful match in any blood-borne disorders. Now, blood-borne disorders can be anything like leukemia, thalassemia, sickle cell anemia, a disorder that our Honorable Prime Minister is very, very fond of and is doing a lot of work on. So any of these blood-borne disorders require the cord blood derived stem cells which express the CD34 marker. Another important thing that needs to be recognized is that despite all efforts, there are chances that the quantum of CD34 or the hematopoietic stem cells may not be adequate to facilitate a successful match or a successful transplant. In that case, what can be done? So that is where we did some work on that, and there's a term called in vitro expansion. In vitro expansion means outside the body. In vivo is in the body. So in vitro expansion is in case the count is very, very low or inadequate at the time of collection, there is an option of expanding those cells. And mesenchymal stem cells are the most expandable, but we have in fact, something again unique to us, because we have a publication on that, where even CD34 positive cells can be expanded. So in case the quantum is less, either in terms of quality or quantity, whatever we have can be expanded to a necessary quantity and quality prior to its banking. Once the banking is done, then you cannot manipulate those cells. Hope that answers your question.
We have the last question, doctor, which is just a second, which is what are the diseases that we can say so far the cure rate is 90% or more using stem cells?
All blood-borne disorders. So any bone marrow related disorder. Bone marrow is basically the little area between your bones, which gives rise to blood cells. So the diseases of the bone marrow are diseases like leukemia or blood cancer, thalassemia, also myelodysplastic syndrome, sickle cell anemia, multiple myeloma. So any of these disorders of the bone marrow, the only treatment, it's not like what can be treated, the only treatment that can be facilitated for cases like this, like these, is a stem cell transplant from an allogenic match. Allogenic, which means somebody who matches the sample Autologous is your own. Obviously, somebody who has a leukemic stem cell cannot be used to treat yourself. So obviously, you have to look for a match with somebody who can help treat leukemia or your blood condition. And once that is done, a successful match can be facilitated. That's the only treatment of choice. It's not like what can be or what cannot be treatment, or what cannot be treated. The only treatment using stem cells is for blood-borne disorders or your bone marrow disorders. As mentioned, something like a leukemia, thalassemia, myelodysplastic syndrome, multiple myeloma, etc., etc.
We actually, one last question that's just come in. I think then we'll just stop, doctor. Which technology do we use for processing of CB and CT?
Priya, would you like to take this?
So we are using for the cord blood volume reduction technology, and cord tissue, we are using it as, we have our own proprietary, so we cannot discuss much about it. We are doing the passaging and this culturing of the cells to store the cells.
Thank you. All our question answers are done. Thank you, Dr. Abhijit, Dr. Padmapriya. That was really helpful. If anybody has any further question and answers, you could put them in the WhatsApp group that you were a part of, or we've already put an email ID here and you could send it on an email to us and we will get back to you. I hope this session was fun and interactive and not extremely technical. I hope you understood a lot of different facts about stem cells, which not everybody talks about. So thank you so much to everyone who was here, present, attended, gave us your time. Thank you, everyone. Good night.
Thank you. Good night and best of luck.
Thank you so much, everybody, for, it's been a pleasure here to seeing everybody on the platform. Thank you so much. Good night.